My name is Dr. Amr Hussain. I'm a resident physician working at one of the largest hospital chains in New York State.
Hello, this is Mujahid Abbasov from Sweden. I'm a doctor and I've been working as a corona doctor actually.
TRT World spoke with two doctors dealing directly with coronavirus patients. Here's how they're handling the pandemic in their respective countries.
We were one of the first hospitals in New York to develop a testing capability for the virus, and therefore we had a large influx of patients over the past 2 weeks who are either confirmed coronavirus positive or suspected of having the disease. This has prompted our hospital to separate out 2 floors specifically for coronavirus patients. As of this point, we do have enough beds to accommodate those patients. However, we are unclear about the number of cases that are expected to increase over the next 2 weeks.
All 50 U.S. states, plus Washington, D.C. and 3 U.S. territories have now confirmed cases of the virus, with a total of around 6,000 reported cases and just over 100 deaths.
As a resident, this has been especially difficult for our program, given that we have a limited supply of residents to handle the large number of cases. All residents on non-essential rotations have been directed to keep their phones on loud and to stay at home awaiting further instructions, as we will be redirected to the most heavily hit services, such as the intensive care unit. Fortunately, our hospital has been in talks with various drug companies and are able to obtain samples for testing treatment options for the virus, and our doctors are working around the clock to isolate these patients and to provide a supportive environment for them. One of the most challenging aspects has been that we need to limit the number of visitors to the hospital to just 1 per patient family. And this is very difficult, as if any of you know your family members in the hospital, it's very supportive to have many family members present. However, given the severity of this infection, we do not want to risk the health of our patients, their families, or other healthcare workers in the hospital. As of this point, our hospital seems to have a process that will start automating the testing capability, which will allow us to test a lot higher number of patients over the next few weeks. However, our hospital leadership is still working on effective areas to separate and isolate coronavirus patients and to ensure that we are taking precautions that healthcare workers are protected in the event of getting the coronavirus themselves.
We have had approximately 2-3 patients an hour, so it's not been too busy. But we have a special corona checkpoint at the hospital now, and it looks like this. We have like an entrance back there where the patients come in. They're getting checked here by a nurse, and then we send them into the doctors over there where I have been sitting.
Denmark has seen at least 1,044 total cases, with 4 people who have died and 1 person who's recovered.
Tonight, it's been much more chaotic out there in society with virus-induced border controls between Sweden and Denmark than it has been here in the hospital. We do have full control over the situation. We don't really have more than 1 or 2 very severely sick patients. And we do have a good system of how to manage the things. I don't feel worried, neither for my own sake or for society as such. We do have it under control in Scandinavia, I would say, at least here in Copenhagen and at the hospital I'm working at. Even though the situation is severe and a lot of people are afraid and a lot of resources has been used and are being used to get the situation under control, it feels like under the circumstances we're under right now, it's okay. Personal effect it has had on me is that it takes an hour extra to commute to work, and there's no toilet paper in the shops. A lot of meetings have been cancelled for me personally, and I know for most people. At the moment, I think the limit is 10 people. Gatherings above 10 people are kind of banned. And yesterday the Queen held a speech on TV, which was kind of a morale booster. And many people appreciate that speech. So let's see what happens from here. It's a special situation, and we are on high alert, but hopefully it's going to work out for everyone, inshallah.